Let me move to Dr. Pallavi. And from Mumbai, we will go straight away to the rural part of Uttar Pradesh. And what DigiSwasth and the group of people with DigiSwasth, they have been doing is creating that referral pathway. And when we say adult, young, catching them early is the key. And let's hear from uh, Dr. Pallavi that what has been their experience and what are some of the crucial things that we need to learn from their experience. So Dr. Pallavi, over to you, please.
Thank you so much, Prabhat sir, and everybody else on the panel, Dr. Chitalkar, for inviting me to join this. I'm grateful that we can share our experiences from the grassroots. So, from Alpana ma'am, we heard about what the policy side of things is, but I would like to, bring you the perspective from Uttar Pradesh, from the grassroots, and these are stories from rural India. So the founder of DigiSwasth Foundation is Mr. Sandeep. He's in the call, and he's a bone cancer survivor. So he is well aware of the hurdles that one has to face as someone who is an adolescent and is dealing with something as grave as cancer. Because we know that cancer is something that can impact you irrespective of your age, and cancer does not discriminate. But for a child, for an adolescent to be able to deal with that and come out as a warrior, a survivor, that is a journey that is that's commendable. So what I would like to do is that I would like to share my screen if that's all right with everyone. Right. So this is just a slide for reference that, like Prabhat sir said, that we should catch them young. And for this, the 4 A's are very important. That is what DigiSwasth Foundation is working on. The first is awareness, then there's accessibility, affordability, and aid. So Sant Kabir Nagar is, it's a rural district in Uttar Pradesh, which has a population of about 20 lakh people. And in the past 15 months, we've been able to diagnose about 63 cases of cancer, of which there were 6 cases of childhood and adolescent cancer. Now, to say that childhood cancer is rare would be wrong, because we all know that it's not the incidence, but it's actually the diagnosis or the screening where we're lacking. So, early prevention, early screening, these are the key things that we want to bring to rural India. Now, to be able to solve this problem of accessibility, I believe that it's important to address the barriers. The first would be communication barrier. A lot of times, the literatures that we have, the brochures that we share, these are all in English, and that is not the primary language of the people living in the villages. What we need to do is that we need to speak to them in a language that they understand. Talk to them in their dialects, and try to understand where they're coming from. The second thing that I would like to say that what is the other thing that we need to address is the barrier that comes with reaching a center or finding the right direction. So at DigiSwasth, we have hybrid telemedicine centers, and we go from village to village, educating the people about what telemedicine is and how they can leverage it. So these are people who don't even possess a mobile phone, and we're asking them to go for consultations over a video call. So you can imagine how strange, how alien that sounds to them. That's why education is the first step that we would like to take ahead in these areas. Another thing that I want to highlight is how these patients are impacted and how their families are impacted. So a lot of these organizations, many foundations, NGOs are often founded by people who have suffered from a particular disease or their families have been impacted by it. So empathy is something that's very crucial to patient advocacy. And I think at DigiSwasth Foundation, we're able to do that. We're able to empathize with these patients. We're empathizing with the villagers and trying to see things from their perspective. So when the patient comes to our telemedicine center, we are able to connect them with doctors. And these are doctors from established hospitals like Tata Memorial or AIMS or Max. And after the consultation, they tell us what to do next. So that is another thing, not just being able to access these institutions or these doctors through technology, but also being able to understand what the next step in the procedure is. A lot of times the patients are lost. They don't know where to go. They run around from post to pillar, not being able to find the right diagnosis, not being able to find the right treatment, not knowing what to do, not knowing how to deal with it, and which I believe leads to vicious cycles. So because you know that you're going to invest a lot of money into treatment of cancer, since you've heard it from a third person that, suffering from cancer, it's stigmatized and you're going to end up wasting all of your savings. A lot of people keep mum about it. They don't want to go ahead with the consultation. They don't want to go ahead with the diagnosis. They don't want to acknowledge or accept it. So acceptance and education, yes, like somebody mentioned that literacy, that is very important. So when these patients come to our centers, we ensure that there is a referral pathway from the center to the hospital, which provides tertiary care or tertiary hospital. We are able to establish that path, and we're able to tell them that this is where you need to go. So our team connects with the social worker department in the hospital, and they tell them that this is a patient that we're sending. Please guide them or let them know what has to be done. These are people who don't have any they don't have a clue about medical records. In fact, even in urban areas today, we seldom find people who have an electronic medical record. So at DigiSwast, we're also trying to generate electronic medical records for them, which enables them to go from city to city wherever they need to go for the treatment, whether it's traveling to Lucknow, whether it's traveling to Mumbai, and they're able to carry the record with them. So there is no lack of communication. And this note, I would just like to conclude. Thank you.
Thank you, Dr. Pallavi. So, as you rightly said, it's the whole pathway, the whole continuum of care is so important. And as a group, you are doing this.